what they call the Rotterdam criteria. So traditionally, what we to diagnose a woman with polycystic ovarian syndrome, we'd say they need to satisfy at least two of three criteria, and those the three criteria that we want them to fall into to have at least two signs of are: one, that the woman has irregular periods, and that could be irregular that they're prolonged or even absent completely. That's the first one, that the woman should have either irregular or absent periods. The second one is she should have signs, either physical or metabolic signs of raised androgens. And when I say physical signs, should have increased facial hair or male pattern facial hair. Women who have kind of like a bit of a stubble on their chins or their cheeks, or male pattern baldness on their heads, or some of them even develop at what we call an Adam's apple if their androgens are that high. Or if you do a blood test on them, you find that they have signs of a low sex hormone binding globulin, or even a raised testosterone above what is the normal testosterone level for a woman. So that's the second group. And lastly, the third sign is signs of polycystic ovaries on ultrasound scan. And normally, doing an ultrasound scan on a woman, you can count what are called the antral follicles on each ovary. And a normal number showing a good ovarian reserve in a woman is if she has anywhere between 6 to 12 follicles on each ovary. With a polycystic ovary, there would be an excess of 12 follicles on each ovary, giving her an excess of plus 20, a total antral follicle count of more than 24. So as long as a woman has two out of those three criteria, she's then classified as having polycystic ovarian syndrome. However, I should also add that polycystic ovarian syndrome is also a diagnosis of exclusion. You have to rule out other hormonal causes of the woman may have these symptoms, such as maybe she has an adrenal tumor, or a thyroid disorder, or a disorder of the pituitary gland. So those things also have to be ruled out before you make a diagnosis of polycystic ovarian syndrome.